up to 90% of routes of drug administration. After that, there was some issue and because of some problem, I was unable to complete the 100% of route of drug administration. Today we will complete first that, then we will move towards pharmacokinetics. In this pharmacokinetics, we'll mainly see the membrane transport and then absorption of drug. Okay, please give me a second. 1 second, please. So let's start from the very basic. So the different mainly routes of administration mainly are of two type. One is topical and another one is systemic. In topical means simply you remember common, like local. Okay. So one is local, another one is systemic. In the local, you will mainly see that there are three types. They are topical. First one is topical, then deeper tissue, and then arterial supply. Topical, deeper tissue, and then arterial supply. In topical, already I have mentioned it will be used locally, directly where it is. Directly it will be used on the site of action. Okay, and the example are see there. Drugs can be efficiently delivered at the localized lesions on the skin, such as oropharyngeal, nasal mucosa, eyes, ear canal, anal canal. Am I audible or not? Yes. So eyes, ear canal, and anal canal and vagina in the form of lotions, ointments, cream, powder, rinse, paints, drops, spray, lozenges, suppositories, or pessaries. So this is the most important point of the whole topic. That is local route of drug administration. You have to remember all these things. Next, deeper tissue. Deeper tissue means you will inject or you will use inside the deep tissue, such as knee joints and hydrocortisone, like this. We will see there. So using a syringe and needle, but the drug should be in such form that the systemic absorption is slow. Example, interarticular junction, bone joints, I told you. So like hydrocortisone acetate in knee joint. And infiltration around a nerve or intrathecal injection of lidocaine. Okay, retrovolver injection, hydrocortisone acetate behind the eyeball. So these are deep tissue administration. So the administration of drug will be inside the tissue directly. Next, number 3 is arterial supply. So close interarterial injection is used for the contrast media of angiography. Already we have seen all these things yesterday. That's why I am going little bit fast. Okay. Next, systemic routes. It is also completed. In systemic routes, what are the different types of systemic route? Number 1, oral route. In oral route, there are some limitations also. I mentioned yesterday. If the person is vomiting and if the person has nausea, vomiting, or if he is senseless. Okay, and it is also slower in the emergency condition, so it is not suitable for emergency. And unpalatable drugs are difficult to administer. Drug may be filled in the capsule in the environment, so absorption of drug may be variable, and onset of action is also slow. And other are some drugs are destroyed by digestive enzymes such as penicillin G and insulin, penicillin G, insulin, or in the liver such as GTN, that is glycerol trinitrate, testosterone, and lidocaine. Am I clear? So already we have seen all these things yesterday. Now, okay, the next point, second point is that the second systemic road is sublingual or buccal, but in that onset of action is little bit fast onset of action is little bit fast too. So this will be unsaturated and this one will be saturated. Okay, so this one is the layer, this one is the layer. In between these two in between these two lipid layers, there will be some integrated proteins and all these things which will create some channel. So we have to study about this lipid bilayer. So a biological membrane is a bilayer. Now you understand why it is bilayer. It is made up of two layers of lipid. So cell membrane is a lipid bilayer about 100 angstrom thickness of phospholipid. Phospholipid means lipid mean only lipid. If in this lipid there are some sugars also absorbed, then these are called phospholipid. And cholesterol molecules. The polar groups such as glyceryl phosphate attached to ethanolamine choline or hydroxyl group of cholesterol. Of these are oriented at the two surfaces of nonpolar hydrocarbon chain. Just I have mentioned about saturated and unsaturated. So when it is saturated and when it is unsaturated, see, if these things are related to lipid, then all the lipid are polar or non-polar. All the lipid are non-polar. All the lipid are non-polar. That's why what will happen? Non-polar substance will be non-polar substance will be transported through the lipid properly. So you have to remember one most important point, that transport of non-polar non-polar and non-ionic substance will be faster, and it will be taking place in passive process. Passive process means without the expenditure of energy. There is no need energy is not required for the transport of non-polar substances. Why? Because these lipid are non-polar, and when non-polar substance will come, they will bind to this lipid very easily, and it can transport from one medium to other medium or from one side to another side. Okay, actually that voice was there and I was looking at that corner continuously, so I took care, no problem. So see, this is the drug in the, okay, we'll see later. First we will complete this topic. So these are oriented in two surfaces, and nonpolar hydrocarbon chains are embedded in the matrix to form a continuous sheet. That means continuous sheet means that layer, continuous layer, that is lipid layer, nonpolar. These impart high electrical resistance and relative impermeability to the membrane. High electrical resistance and relative impermeability to the membrane. Extrinsic and intrinsic protein molecules are also absorbed on the lipid bilayer. So, glycoproteins or glycolipid are formed on the surface by attachment to polymeric sugar and amino sugar or salicylic acid. The specific lipid and protein composition of the different membranes differs according to the cell or organelle type. The protein are able to freely float through the membrane, associate and organize, or vice versa. Some of the intrinsic ones, which extended through the full thickness of the membrane, surrounds fine aqueous pores. That was integrated protein, I told you, this one. This channel I'm talking about this one. See, the 1, 2. So there is a pore or channel. Okay, so this book is telling about this topic. Paracellular spaces or channel are also exist between certain epithelial or endothelial cells. Other absorbed proteins have enzymatic carrier, receptor, or signal transduction properties. Lipid molecules also are capable of lateral movement. Thus, biological membrane are highly dynamic in structures. Now we'll see in diagram and we'll understand it very well. See, this is the schematic depiction of pharmacokinetic process. In this, what will happen? This is the absorption part, this is distribution and storage part, and this is excretion. Okay, so in this what will happen? Drug in dosage form, it will be released in the stomach and the drug in solution. In stomach, it will be solubilized, broken down, and then it will be absorbed into the site of absorption. Then from site of absorption, it will go to blood. Here, freely it will move. So free drugs are there. Some drugs will protein bound, some drugs will be going to the site of action whenever they will bind to protein, and there that will be free. And when it will be free in the site of action, it will show its pharmacological action or therapeutic action. Some drug will go to storage tissue, and there it will be free, and again it will bound and come back. Some will undergo biotransformation. Biotransformation in the sense metabolism. So what types of metabolism? Number one is hepatic metabolism. Hepatic metabolism in the sense metabolism in the liver. Number two is intestinal metabolism. So some metabolism also takes place in the smooth muscle of the intestine. Okay. But the most prominent metabolism is hepatic metabolism. One second. Next thing is that after showing its therapeutic effect, now it will come out along with the urine or bile or feces or sweat, feces in the stool or sweat or saliva. Now we'll see the process of transport of drug from site of administration to the site of absorption. So see, this is lipid bilayer. In that you will see some intrinsic protein which will be beyond the membrane, from one membrane to the another membrane it will be connected. Okay, you will see some extrinsic protein also which will be present in one membrane only, in one layer. In this protein, if you see some carbohydrate or sugar are attached, then they are called glycoprotein. And on the lipid, if it is connected, they are called glycolipid. Now, what will happen? These lipids has two parts. One is hydrophilic part, one is hydrophobic part. Okay. So hydrophobic part is non-polar and hydrophilic part is polar. Since like dissolves like, hydrophobic part will be connected, hydrophobic part will be dissolved in the non-polar medium. Why? Because hydrophobic are those which are not dissolved into the water. And why they are not dissolved? Because the water are polar and another non-polar will not be dissolved into the polar. In the polar, only another polar substance will be dissolved, and in the non-polar, another non-polar substance will be dissolved. As they will follow the universal rule that is called like dissolves like. Okay, now we will see there are two sites. One is behind the membrane, another is inside the membrane, one is outside the membrane. So one is membrane, site 1, another one is site 2. For example, this is site 1 and that is site 2. And if you have taken a drug which has more concentration in one side, then what will happen? It will throw diffusion, it will go to the other side. When it will be having same polarity, either polar or non-polar. Now I will show you how. For example, this is your stomach. What is this? This is your stomach. This is your stomach. In the stomach, there will be some linings. And this is the circulatory system. So when this drug will be, so this is the membrane. Yes or no? Basement membrane. So when the drug will be in higher concentration in the stomach, after dissolution and breaking down, after you take a drug it will come to your stomach for sure, yes or no? So when it will be coming to your stomach, it will first dissolve, then dissolute, then dilute, then dissolute, then dissolved, and then everything will happen and it will break down and it will be free in the stomach, and it will be in high concentration inside the stomach, and it will be in very low concentration or even nothing will be there, minimum or nil inside the circulatory system. Now what will happen? From high concentration to low concentration, these drugs will be transported through passive diffusion. Why passive diffusion? Since this is the lipid layer and their drugs are also non-polar, so non-polar is dissolved in non-polar, so that's why non-polar drugs are very easily very easily transported from the site of absorption, from the site of administration to the site of absorption. So that's why maximum of the drugs are manufactured in non-polar condition only. Okay. See, drugs are transported across the membrane by either passive diffusion and filtration or specialized transport. Okay, so now if these drugs are polar, then what will happen and how it will be absorbed? If these drugs are polar, then it will be absorbed in the form of through the channel, through the pores. So some are ion channel, some are protein channel, some are pores, and like this different gates will be there, and through these gates it will be transported from one part to other part, from site of administration to the site of absorption. Okay. Okay, 1 second please. There is some urgent work. Every time I'm sitting on the teaching or studying, I'm getting some call, urgent call, emergency call. I'm extremely sorry for the inconvenience. We'll continue on the next class. So some urgent call is there. I have to go right now. We'll study later. Please don't mind. Okay, in the next lecture. Thank you so much for being connected with me. Thank you again, and keep studying, work hard, and all the very best. Okay, keep supporting me.